Hi, this is Robert Burk with Ponte Vedra Plastic Surgery and my nurse Carol Michael. We're here to talk about endoscopic plastic surgery, specifically about an endoscopic brow lift. And I'm going to use Carol as my model here to kind of show you some of the things that we think about when we're talking about brow lift surgery. When we're examining the face and the eyelids, the very first thing we want to know is where is the brow position? And in a female patient, the ideal position for the brow should be at or slightly above the orbital rim. And if this is low, this can give this a very heavy and hooded appearance. And some patients come in and think they need eyelid surgery, but really what they need is a brow lift surgery. And the old-fashioned way we used to lift the brow was to make a big incision across the top of the head, peel the scalp down, and then pull it back towards the back of the head. That was a pretty tough recovery from that procedure. It involved making the top of the head usually somewhat numb after the procedure. And with the advances in endoscopic plastic surgery, really is where we started making a much better procedure for brow lifts. And the way we do this now is we make small incisions about 1/4 of an inch in size, and usually we make 5 of them up here in the hairline. And then we use, if this is a kind of a simulation, this is a telescope that's connected to a television camera that allows us to go underneath the scalp and basically free up the entire front forehead skin so that we can then advance this skin and bring it up higher towards and get a nice brow lift procedure. And the way we do that, we actually can kind of control the way we lift the brow. Some people need more lift laterally, some people need more lift centrally. And how we position these incisions really allows us a lot of control of the brow lift. The other thing that really has been a nice advance with brow lift surgery, and we'll focus on this maybe in a little bit. This is this little tiny soft tissue anchor, and this is dissolvable so it doesn't stay there forever, but it allows us, when we lift this brow up, we attach this to the skull, and this anchor basically helps hold the brow elevated while the scalp is basically healing and reattaching itself to the bone. Initially, we tell patients you're gonna feel these things, but usually between 6 and 9 months, they're pretty much dissolved, and certainly by a year, they're completely dissolved by then. So we've got the brow elevated, we've got it secured with an anchor. Usually we need to put 1 small drainage tube in, and that drainage tube comes out the very next day. Stitches are removed usually at about a week. Most people with a brow lift, it's probably about 7 to 10 days before they feel comfortable being back out in public again. But it really can give us a nice natural lift to the brow, help with the hooding, and sometimes we'll do this obviously in combination with an eyelid or blepharoplasty surgery. Let me kind of show you on this diagram a little bit more about how we do this procedure. So this is a diagram here of the forehead and scalp area, and these are kind of the little depictions of the 5 incisions, and I actually make mine a little bit more like a T in this direction because it works better with the camera. But this is what allows us, using the telescope and television camera, to come all the way down to the frontal brow and forehead area. The other thing we commonly work on is the corrugator muscles that sit right here, which is where a lot of people get Botox injected. Usually with this brow lift procedure, we're able to remove some of the corrugator muscle, which helps with those wrinkles there at the top of the nose between the eyebrows. But really, we can free up this entire area here so that we then can lift it up and get a nice brow lift. And then, as I said, we use the dissolvable soft tissue anchors, which are actually sitting underneath the scalp and skin in that position. Sometimes some patients need a little more lift laterally, and we'll use an anchor. It's called a little ribbon anchor over here on the side. But that's, again, using these small incisions, we really can make some major changes to the brow. We hope you found this little video informative. For more information about endoscopic brow lifts, endoscopic plastic surgery, visit us at pvps.com. Thank you for your interest.